back in severe pain because of this stuff. Usually it's this stuff of carrying the baby and all that stuff.
Right.
So I want to sort of teach other providers how I would treat you because you're 2 weeks postpartum.
Yes.
And a lot of people would think that you can't go to a chiropractor if you have a C-section. So we're going to show some modifications, right? Mm-hmm. So the first thing I would ask you when you came back is if you would feel comfortable. Now you're 2 weeks, I probably wouldn't even try this, but if it's like 4 or 5 weeks, obviously the incision would heal. But like I wouldn't even attempt to put you on your belly. How do you feel about how if a chiropractor asked you or somebody asked you to go on your belly, would you think that's a smart thing to try?
I don't think so because I've tried. I'm a stomach sleeper, so I've tried a little bit here and there in bed, and I just can't get.
It's not there yet, right? It's not there yet.
It's not it's not comfortable just yet.
Right.
So I would be reluctant to do it.
Which is very smart. Yeah, 2 weeks because it's not healed. So
Yeah.
typically what I do is I use some gloves. If it's like later, like 4 or 5 weeks, I would check the scar to see if it's gapping, if it's, if it's healed. But there's a lot of modifications. So you're saying that you have pain in your upper back, right?
Yeah, so mid to upper back. I usually have in the shoulders anyways because I carry a lot of my stress here.
Yep.
And of course, having a newborn, it is stressful.
Yeah, you're like this and you're like this all the time.
Yeah.
Even if your milk comes in, if you're not breastfeeding,
Right.
this gets heavier and
Right.
different.
I mean, there's bliss involved in it too.
Yes,
There's positives, but
yeah.
there's that added stress of another person that you're gonna have to take care of the needs. So yeah, so and then my back tends to it's like a domino effect. If one part's off, the whole thing is out the window.
So with her, I wouldn't even attempt to put her on the pillows at this. If she was a little bit further, as I said, we would put a pillow under her belly and her chest because your chest is sensitive as well. But that would be like towards the end of where you're cleared. Does that make sense? So if I was doing an exam on Harmon today, there's a lot you can do. I want to really hammer that home, what we just talked about in terms of there are things you can do when you are exercising and to do. So I could do her exam sitting, right? I could this is so tight. Ooh, Harmon. So even Harmon's always upper trap dominant. You can see that her traps are really hypertrophic or too big. A lot of people are like that because either their chest gets bigger or they're texting a lot or their jobs or everything is sort of forward. So right in here, I'm going to do an exam and I can examine her up here. I can examine her here. I can do massage. So when the massage therapist comes in after I'm done today, they're going to massage her sitting, right? In terms of side posture or the things that are happening in a chiropractic office, that's contraindicated towards that end because we want to make sure the stitches heal, the internal muscles heal, and the guts heal. You don't want to twist in that area. So right now, if I was treating Harmon, I would use a low force device. I wouldn't even put her on her belly at 2 weeks. I think that would cause extreme pain. So today what we're going to do with her 2 weeks post C-section is massage, and then if I need to adjust Harmon, I feel the parts that are here. It's okay if I touch it. There's no orthopedic test I need to do in this region for the thoracics, so I could adjust her or mobilize her in this area. Tell me if this is okay. By trying to get some motion, and right now, in all honesty, her back is like a brick wall, which is common because all she's doing is this right now. I got you right here. If this hurts too much, just let me know. And get some ASMR in here too. So nothing's really moving, right? So again, what I'm going to use is the device. I'm going to bring the massage therapist in to get her some relief because it's so tight, and we need to keep this up because we don't want our headaches to get worse. So that's how a chiropractor should treat somebody post C-section, is to, if they don't modify things or demonstrate extreme caution, there's a problem because this is major abdominal surgery. She looks phenomenal for just having a C-section 2 weeks ago, but even though she looks phenomenal, we need to understand the mechanics and what happened during the surgery, that we don't risk that. We can always modify and do other things to get a relief, but it's really important to be cognizant of what impact that has on our body. And then what's the next?